Are you rolling?
I think I have learned everything from my patients.
So when I look at these things, I feel so helpless sometimes. I feel like this was so disheartening for my entire family.
So it's not just about solving a crossword puzzle or something like that. It's more engaging than that.
Yeah. हाँ ठीक है कितनी बार बताओगे पता है मुझे सब.
I was okay 1 month ago. Yesterday I was okay. What has changed so much?
If you have a purpose, you can fulfill any outcome. Hello everyone, welcome to another episode of Dine with Doc. My name is Dr. Sanjay Arora. Today I'm discussing a very important topic. India is a population of 1.5 billion people. Of that, India is known to have one of the youngest populations in the world. But this population is going to age eventually, right? Today, 10% of our population is formed by people above the age of 60. This, over the next 30 years, is going to double, become almost 20% of our population. So just think, over 30 crore people above the age of 60. Is India really prepared to manage and handle this age group? Well, I don't have all the answers, but I have two distinguished guests with me, Dr. Prem
Hi, sir.
and Dr. Manasa.
Hello.
Welcome to Dine with Doc, guys. So let me introduce Dr. Prem first. Dr. Prem is a geriatrician by qualification. He leads the geriatric practice at Jaslok Hospital. He's associated with many hospitals and many eldercare institutions. And he's one of the pioneers of eldercare in India. So thank you for being part of this show today, Prem.
My pleasure.
Along with Prem, I have Dr. Manasa Nair. Hi, Manasa.
Hi sir.
Manasa is a physiotherapist specializing in neuro-rehab, in mobility of the elders. She has worked with the elder community for many years. In fact, she's been managing my father for over a year and a half. Thank you, Manasa, for being here today.
It's my pleasure, Doc.
So why are we here today? About 5 years ago, my mother was diagnosed with interstitial lung disease or lung fibrosis. She was attached to an oxygen cylinder and she could not move without that. For me, it was very difficult because she needed constant support 24/7. Now, despite me being a medical practitioner, almost 40 years in the industry, I found it extremely difficult to get quality medical care to help her at home. Fortunately for me, my next door neighbor was just exiting his nursing home practice and he recommended a very capable nurse who was able to help my mother during the day. But we still had problems to help her during the night. Gradually, we were able to find the right kind of support. And both these ladies helped my mother for about 3 to 4 years until she passed during COVID. About a year and a half back, my father had problems with his vision. And his health actually just went down. Vision problems and hearing problems, as we will listen to speakers today, are the trigger for some of the problems that elderly face. Falls, that's another issue that my father had. Now, I had to make sure that he got the right kind of support. And again, I struggled because getting skilled manpower to manage for the elders is one of the biggest challenges we face today. And I thought to myself, if I am facing this challenge, being in the industry for almost 4 decades, with the network that I have, what would the common person be going through? And that is what triggered and put this seed in my head that should I do something for the elders? Should I look at the eldercare ecosystem? And that is how the concept of the Wisdom Club was born. The Wisdom Club aims to be a comprehensive, all-encompassing eldercare platform, whether it is care at home, whether it is independent living, or whether it is assisted living, and we hope to build a technology platform to enable all this. And I have two very capable, distinguished guests who will be able to throw more light on this. So Prem, let me ask you first. What got you into geriatric practice? Is there a personal story like mine, or is it more because you saw this opportunity and the gap that is there in the industry today?
Yeah, so I was actually always close to my grandparents. So in a way, it was not very difficult maybe being with older people. But I would say it's a skill. I mean, we should not undermine that treating older people is completely different. So I think geriatrics in a way chose me.
Okay.
But I was always, when I took it up, it was very nascent. But then I felt that I actually could make a lot of change. By that change, I mean I think I have learned everything from my patients. I mean, I can proudly say that because everybody is usually at least, I mean, as I'm growing older, at least 20 to 30 years older than me, or even more so. So it's their experience, their wisdom, and but the conversations with them, I mean, people said it's not easy to converse with old people. I totally disagree. Actually, it's quite easy. All you need to do is give time. So I think that is sort of an essence, and that's why I felt with that, with skill, I think you are able to put so many pain points away. And then if you can, I mean, as I always practice, if you can put it into the definition of health, which is a state of physical, mental, and social well-being, I think that is what encompasses an older person. But never treat all older people as the same because everybody is different. If you think in that thought process, then you will be able to treat every type of older person rather than bracket them into a category, which usually happens, unfortunately.
Right. You mentioned that you were very close to your grandparents. So did you get a chance to stay with them, or they stayed with you? How was it?
Yeah, so I mean, as we all have had grandparents, so, I mean, you have a free pass. So obviously we were in Delhi and they were in Bombay, so they used to come down. So, I mean, we had this extra sort of, you can say, advantage over our own parents because they cannot say anything in front of our grandparents to us. So we took a lot of leave. And yeah, I was very close to them. Luckily, I was able to.
Nana Nani or Dada Dadi?
Dada Dadi.
Okay.
And my Nani is, of course, the oldest as of now. She's still around. She's 90 plus.
Okay.
So she was able to overcome the pandemic. So it obviously shows that there is sort of, and in my experience, if I have to say generally also, a lot of older people did come over it. And in a lot of ways, which we will talk about.
So I have been told that many people who have become grandparents, that grandparenthood beats parenthood by 100x. Unfortunately, I never got the chance to spend too much time with my grandparents. I could briefly spend time with my dadi, and she lived to be 100. And I remember one incident. This was towards the end of her life. She would constantly keep reminding me, why have you not taken a bath? Even tell my father, who was 60 plus at that time, why haven't you taken a bath? Did you see something like this, or have you seen this, that, you know, they go back into almost like their own childhood, and, you know, they have some memory issues? Is that something that you have commonly seen with the elders?
Yeah, I mean, with my patients and older people, yes. I mean, not personally, purely because I felt that, I mean, my grandparents died maybe in the 70s, 80s, so it didn't sort of come up.
Right.
And I became a geriatrician after my grandfather died. So,
Okay.
But I had already joined MBBS. I'm actually the first doctor in my family, so it was quite a sort of a push for them as well, in the sense that they were looking forward to it. He was looking forward to it because he felt that a doctor can make a lot of difference, not only in your family, but in general. But in older people, which I've seen, I mean, I'm lucky to see centenarians. I mean, I've seen centenarians as well. But again, I feel it's varied.
This is memory loss a common thing that you find?
It's memory loss is very common. Unfortunately, nobody looks for it. And people are only looking for the dreaded word of dementia.
Right.
So there are different levels of memory loss. So if you can still have age-related memory loss. Like people can forget things and then remember back. Now the people with dementia usually don't remember anything at all. So my thing to everybody is that you should screen for memory. It's like you cannot just think that it's a normal part of aging. In fact, we actually have to be very, very, as TWC have to be very, very important in sensitizing people on actually what the issues in older people are, rather than generalizing it, because a lot of times, we have seen it all towards the day. So for example, if there is Alzheimer's Day, and there is a lot of talk about it. But it should be very natural.
Correct.
Like you take bath every day, it should be like, okay, memory loss should be seen in that way, looked for it, and then of course, if needed to be treated. Another thing is it's also reversible types as well. So everybody thinks of dementia, everybody thinks of Alzheimer's because that's what is the most common. There are reversible causes like hypothyroidism, vitamin B12 deficiency, then even folic acid deficiency, which can be treated. So
Right.
you just need to check up and you're able to. And there's a very simple memory testing which is done, which hardly takes any time. But what pushes people is a reactive society sort of.
I'll tell you that.
Yeah, people don't want to be proactive.
So when my grandmother towards the end was staying with us, we thought that she's, as you say, losing her mind. But then my cousin, with whom she had stayed when he was very young, and he came and saw her after a few years, he said, "This is not her. This is an illness or a disease." And he was able to pick it up because he came from a different perspective. Yeah. And I think people living close to her were a little more judgmental. And that's what I think you are saying, that, aging is also a process, and it has its toll on the mind as well.
Absolutely.
Great, thank you for sharing that. The Manasa, do you have a personal story as well?
Yeah, in fact, I think I resonate a lot with what you shared and Dr. Prem shared. Similarly, like, I'm very close to my nani. And we have this running joke, that I'm her favorite grandchild. But a few years back, like in my initial years of when I was starting out in my bachelor's of physiotherapy, I noticed like subtle changes, certain memory changes, confusion, like once we got out of the car and she couldn't recognize her own house. But that was a single episode. So, it was kind of like pushed under the rug. But when I started to repeatedly notice these changes, I informed my family, and like almost all families, they were a little reluctant to accept that there may be a problem. And that went on for quite some time. And I think when the COVID pandemic hit, that's when her situation significantly worsened. Because there was like so much lack of social interaction. They were isolated in one house. And then that's when we could really see the changes, how her personality had changed, how she continuously just repeated things time and again. And it not only affected her, right? Like my Nana ji, he's her now primary caretaker. And she experiences a severe paranoia. So she doesn't want him to leave anywhere. She doesn't want him to go out of the house. So now he loves her dearly. And he can kind of see, his loved one slipping out and changing and becoming this person that probably doesn't even recognize so much anymore. And he's also experiencing severe caretaker burnout. So when I look at these things, I feel so helpless sometimes. I feel like this was so disheartening for my entire family. And though we had such good intentions and so much love, but we were still, even besides our best efforts, we were not able to give them that specialized care that they needed at home.
Right.
Right? So when I see all of this, I think this is my plight. So many families might be facing such a plight, right? So if we had facilities like what we're trying to build now, the TWC and many more things to come up with it, if we had that access, it would have been so much easier for my family, for my nani and for my nana.
Right.
They both could have got that comfort and dignity that they longed for. So I think that's what kind of also has always been at the back of my head, that I really want to do something to make the life of my grandparents and millions of other grandparents easier, and for my family as well. So that's what led me to this.
Each of us have had a personal influence to be where we are today, and I think many ventures get initiated because of personal experiences, and I think I'm pretty sure that these personal experiences actually channelize us towards doing what is necessary for the ecosystem. So thank you, both of you, for sharing this with me. You've been practicing for what now, 15 years?
Yeah, I mean, overall since MBBS more than 20, but yeah,
no, I'm saying
it's 10 years, 10 years, almost 10 to 12 years.
So over these 10 years, what's been the role of society towards elder care? And I know that, this whole concept of old age home, Vrid ashram, things like that almost seems like a taboo in our society because of the importance we play as joint societies, as a close family, as a close-knit society. How have you seen the societal influences change over the last 10, 15 years or maybe 10 years of geriatric practice? I'm sure you would have seen some change. Is there some influence on society towards this?
Yeah, I think I would say if we divide it, then the biggest change which I feel has actually happened during the pandemic and post-pandemic. Because somehow the world became very small. Somehow we as doctors and the government and everybody said that the older people were the vulnerable population, which they were. So, but there was older people who were 85-year-olds fit. They were like, why are you stopping me? I mean, I don't have anything. I don't have a comorbidity. Then why should I be stopping?
What do you mean by comorbidity?
So comorbidity means, of course, any diseases like hypertension, diabetes. So usually, I mean, older people can have 1+2. So it's like one pay, one free, or it becomes even more. You can have maybe multiple.
Right.
But a 60-year-old can have multiple diseases, but a 90-year-old without disease can be more fitter. So I mean,
Just to hold you on that in your practice, what percentage of the elders actually have a comorbidity? Out of 100 patients that you see, how many of them will have a comorbidity, whether it's diabetes or hypertension or elevated cholesterol or whatever else is considered to be part of your classification of comorbidities, weak bones or osteoporosis, etc. So what percentage in your practice you have seen that?
so I think at least 70 to 80%.
Okay.
Yeah, because apart from these diseases, as geriatricians or as eldercare providers, we obviously look at specific things. So the cognitive part becomes important. So if there is a memory issue, if there is a fall risk, if there is one of the most taboo topics which I know, especially for females and males both, maybe incontinence.
Okay.
Then depression.
So incontinence you mean is inability to control bladder the movements, right?
Yeah, in fact, I have had patients who have had fecal incontinence as well.
Okay. So bladder and bowel.
Yeah, that becomes, of course, not always because of spinal injuries, but
Right.
also because of sphincters becoming more looser.
Okay.
And the big taboo happens in females because they don't understand who to say it to.
Yeah.
So a lot of times, is it to the husband or is it to the son? Is it to the daughter-in-law?
Daughter-in-law, right.
Or sometimes maybe it's in their mind or it has been fit by society because they said that is normal with aging. You're forgetting means how? Because you're getting older.
But have you seen that families have become more nuclear rather than that whole concept of joint families? Have you seen that change? And has the acceptance for managed elder care, how has that changed over the last 10 years?
So I would say earlier it was of course all about if we can live together. Like I still have some friends read in my MBBS in Aurangabad where it's all one house. So there are 4 brothers who are. So then we see that we obviously feel everything is sorted out. So like children play together. If they have to go out, then they take care of their children. So everything is like more of an ecosystem.
Right.
But as we are going more and more further, even the same city, living in the same city, people might not be living with their parents.
Correct.
And it is purely because whether it's workplace, a lot of things, whether it's schooling of children, and even if there are people who are in the same building also. So it might technically not be a nuclear family, but it is a nuclear family. It's like first floor, 10th floor. So maybe the son, daughter-in-law, they go and visit every day.
Right.
But then it's not in the same house. So of course, definitely that has happened. And I wouldn't say that we have aved the West in that. It's just organically happened because more and more people have got better opportunities. And I've even had conversations with parents. So like the older parents. So they are like, we would want best for their child. So obviously for education, if they don't get in the same place, they go. For job, they go. But at the same time, there is a tendency of them to think that but why are they not, coming back?
Right.
Or why, so it's like if they go for holidays, they cannot adjust completely. And as they get older, of course, weather comes in. So a lot of things are there. So that's where I feel we should not only look at whether there is nuclear families or joint families. We feel that every type of older person can be helped. So for example, if it's a joint family, there could be still something taking care for the older person because they might be in the same home but not necessarily have the time to take care.
That's a great point that you made, that even if you're living as a family, the care element that a specialist like both of you will be able to bring could still be needed just by. So one element that gets probably addressed is maybe loneliness.
Yeah.
I wouldn't agree, Doc. No, I don't think like loneliness, just because you're in a joint family, that loneliness. Everyone's still busy in their own lives, their kids. You have to do something that is relevant for that person, Aake 5 minute, 10 minute dinner kha liya, baith gaye. That's not solving the problem. That still doesn't mean, okay, I have solved the problem of loneliness. Loneliness doesn't mean that large number of people hai, to mera loneliness chala gaya. So I think even in larger families, This is very common. The feeling of loneliness, isolation, nobody understands me, nobody knows what kind of issues I'm going through. So I think that's also fairly present in joint families, not just nuclear.
So just being physically present in infrastructure is not enough.
It's not enough.
Yeah, in fact, just to add to that also, what happened in the pandemic actually blurred the lines. A lot of people were actually giving, they had online, I mean, it was an online work.
Yeah.
So the older people had expectations at their home. So they are going to be actually spending time.
Right.
But it wasn't that way. So they were like, but what's happening? No, they are not actually spending time because the lunch was not at that lunch time. So it was like 9, 10, whatever. I mean, people were. So that was a big eye opener that just because you have people at home doesn't mean you're actually. And this has nothing to do with what strata of society they are. In fact, I have seen a lot of loneliness in the strata where everything is there. You have everything, but nobody to share it with. So, and that's where I feel that ultimately we have to take the beacon of making sure that loneliness can be solved, not necessarily. A person can be independent alone. An older person can be independent alone. But a person having multiple mates can still be lonely. So that is something we need to...
So engagement is important.
Absolutely. Engagement is the key.
We all see that we want people to live longer, right?
Yeah.
And lifespan in India or anywhere in the world is increasing. But we also know that lifespan and health span, there is a big difference.
Right.
What has been your experience that, people live longer, but their health does not stay in sync with how long they live? And how has been your experience in that? And would love to get your perspective on the same.
It's exactly what we discussed, right? Typically I'm talking about the Indian, region, is that the mentality is very like reactive. कुछ हो जाए तो मैं कुछ करूँगा अभी. कि स्ट्रोक हो गया अब मैं फिजियोथेरेपी या एक्सरसाइज स्टार्ट करूँगा या अब कुछ हो गया then I will do. There is no concept of prevention, no concept of being proactive, no concept of having a life, sometimes it's like almost like a term or sentence कि I've reached this age, मेरे बच्चे सेटल हो गए हैं, I have retired, अब मेरे को कुछ नहीं करना, मेरा क्या ही करना है, कोई ज़रूरत नहीं है. Especially people, whose spouses aren't there anymore. Especially those people, a lot of times they just feel that they have no purpose, no value in life. But we have to understand this, this period, it's not a period of decline. It's a period of opportunities. You have so much now accessibility and availability to you, and now, the world is moving towards better care for the elderly.
Right.
So having a proactive nature, looking at not just your physical needs, not just checking your blood pressure, heart rate, medicine, etc. Your mental needs, how are you stimulating yourself mentally? Are you engaging in enough activities? Are you meeting your friends? Are you going for kitty parties? Are you finding a purpose? A lot of these, are you engaging in any spiritual activity? Is that something that brings you joy? So health has to be looked at holistically.
Right.
It's not that I'm free of back pain or neck pain. It has to be that mentally, socially, emotionally,
Right.
I'm feeling better. And it does not mean that, I can't have healthy aging or I'm bound to have problems. That's not what aging means.
Right.
So understanding this gap and bridging it is what we have to create awareness about.
So what's been your experience on bridging this gap between lifespan and health span? How have you been addressing this?
So I think I read very recently, and I fondly remember that we met first in a crossword only.
Correct.
So and you obviously are I think you're a voracious reader. I have read a lot of medical books, but I try to balance the other out. And it's a very simple thing. We always try to stage a disease. We always do. But we don't stage an older person. Why do we only talk about age? So the motto should be stage them, don't age them. So don't look at the age. A 76-year-old Usha Soman, who's the mother of Milind Soman, beats Milind Soman in marathon.
In running.
Absolutely. She's ultra flexible.
She's the one who runs in a sari.
Yeah.
Bare
Barefoot.
feet.
Yeah, bare feet. And Milind Soman, we all know. So, and it's a daily thing for her. I mean, we are highlighting it, but it's very normal for her to do that. So let us not look at the age at all.
Very nice.
But
very nicely said.
But the key to whether you are independent or whether you are dependent is on your health. how you age is directly proportional to how your health is.
Absolutely.
The more healthier you are, you age well.
Absolutely.
The more unhealthy you are, you will not age well. But that is in your hand, not at 60. In fact, much earlier. But that doesn't mean if you realize at 60, you should not work for your next 20 years or 30 years. So that's my strongest thing is also older people should understand their body. Just because my wife or my husband or my friend can do that 30 minutes run doesn't mean you can do it because you have not done it for the past 10 years.
Correct.
Do it individualized, and a lot of times just don't go on what others are saying.
Sure.
I think that is one of the most. So the key I feel is health, but you can actually have in your control how you age. But that is something that people don't realize.
I really like that. Don't age, but stage.
Yeah.
Very nicely said. Let's move on to the families play a big role in the management of elder care. So would love to get both of your perspectives. Maybe you can start with you, Manasa, that this whole social stigma around elder care, the willingness for the children to pay, them wanting to remain engaged with the health of their seniors. What's been your experience in that, and has it changed? Of course, you will have a much bigger experience, but let's start with Manasa first.
Yeah, definitely. So I think, within our values and traditions, we have it inbuilt in us, that we have to take care of our parents, and that is our familial duty. And many times when we aren't able to do that in the setting of a home and we want to seek external support, it brings us a lot of shame or feelings, guilt, a sense of failure that somehow I failed my parents.
Right.
And there is also fear that maybe my parents might think that I'm isolating them, I'm abandoning them, I'm sending them away. So what my understanding is that we need to shift the mindset from sending them away to I'm giving you the best care possible. Okay, I'm going to a place where you will have the best care. And it's never going to be that the family is not, we're not looking to replace any family.
Right.
That's the family can never be replaced. We're just giving you a bigger family. Okay?
Nice.
And we are making your family be a part of everything, the decision making, whether it's we have a karaoke session, please, everyone's welcome. We want people to engage, we want people to...
So you'd like the families to be involved?
Yeah, 100%.
Okay.
100%. Whenever, we have these sessions, I would like that each and every family member comes and sees and participates, not just sees, participates in these activities. And be a part of this active decision-making process.
Sure.
So that's what I feel.
Right. And this whole social stigma part, I mean, how have you seen that evolve over the last decade? Has there been a little more acceptance now?
I think there has been, but unfortunately the part is, I will say, one of the very big two mediums in India is films and cricket.
Right.
So films have already earlier shown, if it's an old age home, it's black and white. I mean, things are very mundane. But at the same time, then you had films like Munna Bhai MBBS, and then your Lage Raho Munna Bhai, which is more of, you can say, an old age home setting.
Right.
People are happy. People are happy to live together.
Correct.
In fact, they are fighting to not lose that hope. So I think one of the most important things as far as a caregiver is concerned is they want to take care of their older person. And the guilt part, which we have already highlighted. The problem is guilt comes anyways, but societal pressure is how you can put them. How you can not manage. Or it is your duty to manage at home. But what are we saying? We are just saying it's another home which is like home, but you are actually putting them in a place where you can take better care of them and still live your lives.
They manage better.
We are not understanding sometimes they are doing everything. Okay? They are the breadwinner. They are the finance person. They have their own children. They have their own family.
Right.
So what amount of caregiver stress do they have? So I always tell all the caregivers one thing. Everybody pushes themselves, but you are not superheroes. You have your limitations. The day you understand you have limitations and you can take help is the day you actually will take better care of your older person rather than doing it otherwise.
Correct.
And everybody pushes themselves because we know that we can do it. Whatever said and done, it's my parent, I have to do it. How can I not do it? But the same, I think there is a change wherein people are realizing now if there is a specialized care, and yes, affordability can come in that. But if there's a specialized care and I want to give the best care for my older person, That's enough. It's not necessary. It has to happen in home. They choose it that way. Maybe it has to be closer to the house. I can go very frequently. Both schools of thoughts. A lot of people don't want to know what's happening with their older person. They are like, you just take care. A lot of people come also. But ultimately, we also have to understand that they might miss home. So it becomes a bit of a situation where we have to make sure that they are comfortable where they are, but at the same time, family keeps visiting.
Sure.
So I think the comfort that we need to create is for all. It cannot be the target that the comfort is only for the person.
Correct.
If the attitude is to make that ecosystem,
make the family inclusive.
Yeah, then is when I think the best care can be.
I think it's also that, they haven't experienced that sort. Like Dr. Prem said, that there's already a perception, right? A preconceived notion that this is how it is. But when we bring out TWC and when people experience it, I think that's going to change a lot. Change the mindset of people of what they have in their mind and what they're actually seeing.
Right.
So expectation versus reality. Like, to make them actually see they are going to be cared for the way that you would have wanted or much more.
Better than that.
Much better.
Right. One of the challenges that I had faced, like I mentioned earlier about when my parents needed support, was the need of skilled staff. And you've obviously had the maximum experience between the three of us in this. How has that changed, and what do you think is the need to improve the type of care that is needed, or the type of staff training that is required, or the skilling that is required to take care of the elders? I'm sure it will be slightly different than what it is for other category of patients.
So basically, always we keep talking about numbers. We're like, India is going to be an aging population and this many people are going to get older. But the buck stops is who will take care of them. So human resource in taking care of older person is most important, and that includes everybody. It includes caregivers, it includes companions, it includes physiotherapists, it includes even doctors who can actually make home visits in a way better as compared. And of course, the most common use is nurse, because nursing is something which has always been the pinnacle, and it is something that people use maybe throughout. I mean, if they have a prolonged illness, they might have to use anyways. So the way is to invest a lot, like obviously we are trying to do, in training people. Because see, nothing comes naturally. You cannot just say that a liking for older people is one thing. Taking care of them is another thing completely, because it's skill based.
Right.
So one has to understand the older person in and out, how they will react, how they will not react. Very simple. Not able to hear. The wheelchair is here. Come, let's go. But you're not realizing that the person is not registering it because the hearing aid is out.
Correct.
So that sensitization has to be, first you have to see, the hearing aid has helped. So that basic thing, if you're taking it, they already know you're taking extra care because I actually forgot. So the fine tuning is not always only in the knowledge and how to take care of old people. Soft skills matter a lot, and the cadets are all different. So there has to be a nursing cadet, there has to be a caregiver cadet, there has to be a physiotherapy cadet. Physiotherapy also to a great extent is one of the most important. I mean, Manasa obviously knows that and she can highlight that also. Why? But most important thing is it's a multidisciplinary approach in geriatrics.
Sure. Yeah.
If one person thinks they can do everything about elder care, it's not going to happen. And it never happens.
Right.
It's just thinking huge but not delivering. So I think taking more and more help from different faculties and making sure that the training is robust and giving more practicalities rather than only sort of putting it into theory.
What's been your experience on affordability and the willingness to pay? Do elders want to pay for themselves, or is it the family that wants to pay? So, financial decisions, who takes that? Because what we are trying to do here is be a little more proactive. Right. There's no real medical condition. Right. Dr. Prem is looking probably a little more, when he's at Jaslok, a lot more medical conditions, but what you are looking at is a little more proactive. So what's been your experience? And of course, then we'll ask Dr. Prem what's been his experience. This whole willingness to pay, financial independence, is it really needed? How much can I afford? So what's been your thoughts on that?
Definitely, I think a lot of the elderly population are dependent on especially their children to make those financial decisions for them. There is a segment, of course, that makes their own financial decisions and stuff like that. But it's most often women, widowed women, they don't have that power, or they're not given that onus of managing their own finances.
Okay.
And that somehow becomes a little bit of a problem in getting the right kind of care to them. Because what I've noticed is that children are willing to pay for probably their children. They'll do anything for their children. They'll pay large amounts of money. But if it comes, the same thing comes for their parents, there's that little bit of a hesitation or a little bit of, oh, is it really needed? But is it that I need to do so many sessions? आप थोड़ा सिखा दो वो caretaker को सिखा दो वो करा देंगे ना.
Right.
So, you know, a lot of this can change with awareness. A lot of this can change with options. Our government is doing so much now. And through the Ayushman Bharat Yojana,
Right.
they started insurance for people over the age of 70.
Right.
So even our government is becoming more sensitized to the fact that elders need this kind of care.
And
so
focus.
So I'm sure with time it's going to shift, but currently they don't have that awareness. They don't understand the need. They don't understand why it's so important. It's our duty as medical professionals or just citizens to,
Sure.
you know, change this kind of awareness.
Who pays the bill normally in your case? I mean, is it the patients themselves, the elders, or their family members?
Yeah, a lot of times I think it's the family members. But again, I think it's directly proportional to how independent they are physically also. So I feel once you're not physically independent, then of course that decision making goes out of your hand. That's why, of course, this is a good platform to say that living will is very much legal.
Right,
So older
right.
people should have their, in fact, young people, a lot of people that I know, my age group have even started putting their living bills purely because when we know that what has to be done. And advance directive is very common abroad, wherein a person is going to, when they're healthy, mentally, physically, they take a decision that this is the amount of care that I need when I'm admitted. Now, but most of the time, I will say they might understand that no, it's good to go to maybe a geriatrician. It's good to go to. But then the buck might stop in asking the children.
Right.
Whether it's a lot of times, it's not even about affordability. It's just that maybe they are not taking those decisions for themselves anymore. But there is also a huge chunk still, I feel, who take their own decisions, but not necessarily because they can do, but because there is nobody to ask as me.
Sure.
I mean, the children are not there at
there,
all. So,
right.
so who are taking? I mean, it's going to be the husband taking the decision for the wife, and the wife taking the decision for the husband.
Right.
I have also seen in families, of course, grandchildren, at least to the OPDs they bring there. I'm not very sure it's going to continue forever, but I have seen that grandchildren are very much interested.
Okay.
And they do bring their older person. Now, follow-ups can always be an issue because if there is nobody to get them, that will be the challenge. That is why I also feel something what we are obviously trying to work on is the concierge.
Right.
So ultimately, how can you bring an older person from point A to point B without them worrying about the fact that they cannot avail the point B because they cannot go to it?
Sure.
If we can be that bridge. Same as I want to watch a movie,
So
but I cannot do.
So at TWC or the Wisdom Club, when we are starting the Center for Assisted Living, can you just explain what kind of category of care that we would give? What will be the various types of care protocols that we will follow? What is the kind of, I don't want to call the word patients, but guests or residents that we'll be able to take care of? What conditions that we'll be able to address?
Yeah, so usually, of course, because it's assisted living means they need some level of assistance. So usually assistance can be categorized into whether their memory is okay or not. So cognitive means brain health, whether they're mobile or not, whether they're able to do their basic activities of daily living. So if I have to say what are them, bathing, mobility, dressing up, urination, passing motion. So these are all basic activities.
Right.
If older people need help, so the degree of help they need.
Sure.
So it can be only one or two, or it can be everything. So there is also something known as instrumental activities of daily living. But that means people are independent and they can do things like doing their finance, everything, which is not going to be the people that we might actually look at. That is more for senior living.
Right.
So if cases wise, it could be a plethora of things from neurological cases like people who have had strokes or people who have recovered from strokes completely, but they have comorbidities, people with long-standing diabetes, people who are actually bedridden also to a great extent. Then short-term stays also are something which we are obviously looking at, wherein it could be immediately post-op, which is orthopedic surgery, which could be spine, which could be hip surgery.
Right.
Then I think one of the very important things which I want to highlight is that we at TWC would also want to give respite care. So I know for a fact that when I was in AIMS, we have actually done this, wherein an older person, of course, a government official wanted to go. And he said, you keep my parent for 1 month. And we kept. And we took care. It was some basic activities of daily living were needed.
So you're saying when the caregiver has to
Yes.
travel
Yeah.
and they don't know where to leave their parents, then
Yeah.
TWC will provide that facility
That
that you can
facility.
keep them here for 15 days or a month
Yeah.
while the children travel.
Yeah, so they know mentally also that they are taken care of, but at the same time, they are not stressed about the fact that they're alone home and they might
Right.
have to actually have to. I mean, there are a lot of other things which
Right.
also come into this.
Sure.
And one of the most important things, I think, whatever the condition in TWC would be engagement. We would not want anybody or everybody actually, we would not want anybody to actually just be on their own.
Sure.
We want them to be actively engaged with other residents, with whatever activities we are doing, because the goal here is to spread more of togetherness and getting more of a family extension rather than them thinking, oh, they are moving on to somewhere.
Building a community experience.
Yeah.
Even people want to come in for rehabilitation, who their sole purpose is that they need intense rehabilitation. For example, like I've heard many people telling me my grandparent had a stroke or my parent had a stroke, then physio करवाते थे हम आधा घंटा दिन में कुछ ज़्यादा फर्क नहीं पड़े. अरे कैसे फर्क पड़ेगा? It has to be intense. It has to be consistent.
Right.
It has to be done for a certain period of time. So people who want rehabilitation also can come to our facility and that can be provided to them.
Sure. And what are the latest innovations that you have seen in the elder care ecosystem?
There's a lot coming up. We have, of course, we already have some of the wearable devices, the wearable sensors like the watch, the rings, all of that which detect a lot of parameters, health parameters, for example, your sleep cycle, your heart rate, your respiratory rate, your oxygen saturation. You have the glucose monitors which are continuously monitoring your blood sugar levels, indicates when you get a spike or a drop or anything of that. We have now sensors which are within your environment. Fall detective floors, temperature change sensors within the wall. So there are so many things that are coming up. There's AI which is doing a great thing. It analyzes data, detects health trends, and it can identify things before you even, you may detect that this person may have a hospitalization soon. So using these things, not only for the person, for the caregiver, it gives that information to them. It allows them to analyze that for training purposes, simulations, AI chatbots, online training. So there's so much that's coming.
So
There's
technology
robotics.
plays a big role today.
Of course, mobility aids, robotics, it changes a lot of things. It has to be, as you move forward, technology has to be an integral part of the care that we provide.
Very nice, very nice. So Prem, if you would like to summarize that, an ideal elder care facility that we are all trying to build together, what can, the families look forward to that we are trying to do out there?
And so I think as far as I said, the definition of health should be our pillars. So it should be physically, socially, and also mentally. And at the same time, we need to also take care of an extension of actually being engaging, create a community and create a good support for the caregiver. Ultimately, caregiver has to be at peace wherever they are. They might be next door, but they have to be at peace that at TWC, if their older adult is there, they are being taken care in every possible way, whether they are there for a short term or whether they are for a long term. Of course, we will want obviously to have individualized plans for every individual, because most heterogeneous population is older adults. But these would be the basic pillars, and we would obviously want them to focus on what they can still do rather than thinking what they cannot.
Sure.
Because the path to successful aging is to strengthen your weakness to overcome it. To strengthen your sort of what is good to overcome your weakness and to make sure that you get adapted. So I'll just give a quick example. There is a pianist, Albert Schweitzer. So he is no more. Of course, he got Parkinson's disease. So we all know Parkinson's disease has got tremors, it's got rigidity, difficulty in movement. So he people were like, what concert is going to he going to do now? So it's the end of story. But he announced a concert. So and then he was like, it was a hit. So he only played those tunes which need trembling. So that is adapt. That is called successful aging. So we want to help older people to make sure that they are not weak in any way, but they can actually adjust to it and become stronger. And so if we can be
Nice.
that strength in the arm,
Right.
whether it's at our facility and overall in the community, I think we will be achieving what we want to.
And when you say physical, mental, social, in physical, your core health gets addressed in
Absolutely.
that. Right. Excellent.
Excellent.
If there's one memory that you want to share about the interaction with your grandparents, what would it be? I mean,
I mean, there are quite a few. But I think one thing that comes to mind is, so my Dadaji, and in Malayalam, we call them Apupa. Okay, so my Apupa, he's not with us anymore. He passed when I was 4 years old. But one very fond memory I have of him is, so basically, I'm born in Mumbai. And my mum is born in Ludhiana, Punjab. And my dad is from Trivandrum. So my grandfather had come up with a nickname called Pibita. P for Punjab, B for Bombay as it was known before, and Ta for Trivandrum. So he used to call me Pibita, Pibita, and he would love giving me tel wali malish. Okay, and I was a stout little muscular kid. And he asked me after doing that tail malish to pose for him and like a bodybuilder and show him my muscles. So whenever I think of that, it brings back a lot of fond memories of him, and I really wish that, I could just have that one chance.
Am I okay to call you Pibita from today?
Sure.
But that's only reserved for him.
No, of course. Yeah.
Of course, I will refrain from the tail kamalish then. What about you, Prem? Is there some special food that brings memories of your grandparents that you eat, or something that your grandparents used to make for you, your grandmom especially?
Yeah, plenty. I mean, I feel that the way, grandmom somehow, they are just superhuman. They are able to make things quickly and at call. So for example, if I said something, my grandfather is like, you not refuse. You have to make it. So that is one of the biggest things that it was, and they used to do everything and anything and everything. So, but one of the memories, if I have to say, is ultimately somehow he always said that you're going to do something. So that belief was there from young that something, I never realized that I'm going to be a geriatrician and actually going to do that. But he always said that you should always believe in what you want to do, but at the same time, look at the bigger picture. Because ultimately, what matters is you need to break it down rather than think what you'll do only today. So I think that was something which has always stayed.
Stuck with you right. So this has been an enlightening discussion on the evolving, space of elder care in India. It's just started, and the Wisdom Club or TWC hopes to play a significant role in, as my very esteemed guest said, physical care, mental care, emotional care, social engagement, comprehensive well-being. Don't look at age, look at stage. You can have a very healthy senior, you can have a very unhealthy youngster. So don't look at the age. Let's be proactive, let's not be reactive. Let's work together as a community, as a team, to make sure we give that extra focus to the elders in our ecosystem. So if you know someone above the age of 60 and who needs a special attention, be proactive about it. Don't wait till they need it. Make sure that they don't need that care, and let's be proactive. Share this video, share this podcast, and make sure they don't just live long, but they live better.